my god, wait, what? Good morning. I am about to head through to the hospital for my pre-op. It is 2 days before surgery. Surgery's on Friday, today's Wednesday. So I am going to get my COVID test because you have to have your COVID test no more than 48 hours before surgery, and they have to do all of the pre-op things. I know that it's a bit of a different environment in the hospital right now because of COVID, so I'm not sure if I'll be able to video any of it, but I will try my best. I'm not sure if you can actually hear me through this, but this is the Queen Elizabeth University Hospital, and I'm headed to the maternity building because that's where gynecology is. So change of plans. I thought that my appointment was going to be at 10 and I'm chronically early to everything, so I got here at 9:30. It turns out my appointment's at 11, but the same thing had happened to the woman in front of me, that she thought her appointment was at 9:30 and her appointment was at 10:30. So I guess they're telling people an hour earlier than what they actually have them scheduled, which is a bit of a shame, but at least it's early, not later, because that would have definitely been a problem and thrown everyone off. So just sitting here on a bench with my coffee. But yeah, so far I was just given some urine tubes. So she said like, oh, if you just want to get ahead on it, then you know, here's these in case you feel like going before 11 o'clock. I've got one to do for my pre-op today, and then I've also got one that I'm supposed to use right before coming in for surgery. So like that morning, taking a sample. I'm guessing that these are pregnancy tests. I don't know, I guess, and also if you have any kind of infection. But yeah, that's so far all that's happened. I'm from the US originally, so when I've had to do like urine tests in the past, you get like this bigger cup that you use. So when I've seen these before, I've been like, oh my god, wait, what? But they give you these things, and you like pee into those and then you pour it into the little tube. So if anyone comes over and is needing to do a urine test and is confused by the tiny tube and how you're supposed to like make that happen, they do have these like cups that you pour them in, so you shouldn't be too scared. Hello, so that is me done. I went in, did my urine sample thing, which was, I guess it wasn't a pregnancy test, it was to check for like infections and things. But the other one that I am supposed to do for Friday is a pregnancy test, and then they already have my bloods and everything. But I don't know if you can hear me that well because I'm outside and obviously like next to the hospital, so I will go home and I will tell you all about everything that happened. And yeah, in the door. So I'm going to sanitize my mask. It's got this thing, I don't know if it actually does anything, if it works, but marketing gets me every time. And I'm going to wash my hands thoroughly, and I'm going to make some lunch. Funny story about the whole blood drawn thing. I have very shy veins. They don't pop up very easily. And so today I had a fairly noticeable one on this arm, which was great. And there was no problem getting the needle in. Sorry, disclaimer, if you're squeamish, maybe don't listen to the next like few seconds. I had my blood drawn, and then, you know, we put a bit of pressure on it, then she stuck on the plaster. And we were going through paperwork, and as we're going through paperwork, I like went and just kind of like rubbed my arm, and I noticed it was wet, and there was just blood like everywhere. It was just like running down my arm, and we both looked at it and we were like, oh no. And I had just like not clotted, and she had just asked me a question previously, like, do you bleed more than the average person, like from cuts and wounds on your body? And I was like, no. And I was like, well, maybe today I do, I don't know. You're not allowed to be up here. Can you please get down? Hey, oh boy. Go make some pasta. Nom, nom. Hello. Oh, good. Hello, little friend. So I got home, made some food, just eaten. Yeah, I feel like now I should update you, even though the street noise is really loud. Sorry, I don't have like a setup. But I got home and this came in the post and I'm so excited. I have a friend who, they have endometriosis, and they wrote one of the essays, which this is a collection of essays on hormones, so it covers so many things. There was a Kickstarter that was going on to fund it, and obviously the Kickstarter was a great success, so I got sent a book. It's one of my Kickstarter rewards. I would have purchased it anyways. It is fantastic. I mean, I'm just reading the titles in this and it just covers so many different experiences of dealing with hormones. Yeah, it's fantastic. So I'm definitely going to be reading this, probably shedding a few tears over this during my recovery. Anyways, so my pre-op, it went well. It lasted about an hour and a half. So it says when they send you the letter that it could take up to 3 hours. Because there's reduced intake right now because of COVID, I think it just went a lot faster than usual. So they were able to have me do my P test, and then after that they brought me back to discuss things. First I had to do my COVID swab, which I have watched all of these videos in like TikToks and things of people just losing it. I'm not sure if the nurse that I had that did mine was just like super expert or what, but she like prefaced it saying like, oh, you know, some people really gag with this and the nose bit is really like not comfortable, so you know, hopefully it's not too distressing for you. And I was like, all right, let's do this. And she did the throat swab. I didn't gag or anything, like it wasn't that bad. I don't know if this is just from like having a childhood full of strep throat and having yearly strep throat swabs or what, but I didn't have a problem whatsoever with the throat swab. And then when she put it up my nose, like, it was a little bit uncomfortable because like nobody likes putting anything up their nose, but it didn't feel like my brain was being tickled or anything like that. It was totally fine, but I didn't have a problem with it at all, which I feel very fortunate that that's the case. After my COVID test, then I had my height and weight taken, and then we went through to the office and we talked about the paperwork. There was a lot of paperwork involved. I have been given this enhanced recovery after surgery program. I had this the last time that I went in for surgery. It's pretty great. You're given these like these sachets, I don't know. You're given these packets, and they're like, you pour them into water, and there's 3 of them, and you're supposed to take them in the lead up to surgery, like at various intervals, including like right up to the hour before your intake. And it's supposed to help you come around faster. It has nothing to do with like moving your bowels or anything like that. It's just to like give you vitamins and hydrate you thoroughly so that you recover better. And then I was given like a welcome to our ward thing, same day admission unit pamphlet. This is my pre-admission lounge entry because COVID, so you know, you need to have documentation. I have to fast from midnight, and then I have to stop drinking water after 6 o'clock. My intake time is 7 a.m. so yeah, that's like an hour before my intake time. I need to stop drinking water. I've got this reducing your risk of blood clots. So that's another thing that they did when they took my height and weight, is they measured my calves and ankles and like the length of my knee to ankle for compression socks. So they are gonna give me 2 pairs of compression socks, and they said, you know, until you're up and walking around like normal, moving normally after surgery, so maybe like a week, wear the compression socks all the time, just to prevent blood clots. She said there's no reason not to wear them because we're giving you 2 pairs, so 1 to wash, 1 to wear. So that's really good that I will have those, and I'm also going to be given an injection in my stomach to help with, like, not with blood clotting, but like prevent blood clotting. And then I was given this like guidance for designated visitors and a pass for my designated visitor as well. But yeah, that's my stack of paperwork, my preload stuff. I've got my P-tube for the morning of surgery, and that's that. And then I got to see the junior doctor briefly, who will be there in the ward the morning of my surgery, so I'll see them again. But the junior doctor and she just had a feel around of my tummy, listened to my stomach, listened to my heart, my lungs. We just had a wee chat. I'm concerned about previous scans that I've had showed things like my left ovary was adhesed, like it was attached to the wall of my uterus. I've had endometriomas that were visible on scans, and I was told about a year ago when we first talked about having surgery that, you know, if we were trying to look at my, like, preserving my fertility and things, that maybe we should put off surgery because they may end up doing more damage to the ovary or needing to take the ovary altogether. But at this point, I'm not planning to get pregnant anytime soon, so I am going to prioritize quality of life right now, which it seems like a lot of the time when you go in for surgery, it's one of 2 things that you have to do, which sounds really awful, but it's kind of like, are you looking at your fertility first and foremost, or are you looking at your quality of life? I mean, in an ideal world, you would be considering both, but sometimes if you're looking at having a baby soon or trying to get pregnant soon, what you would normally do to help your quality of life, you wouldn't do. That's just because they could do more damage by operating than if you were just trying to get pregnant for a while and seeing what happened. So that's where I was at about a year ago, was having that kind of conversation. But my circumstances now are, I've just really got to get my quality of life back on track, because I can't keep being hospitalized every other month. I can't keep bleeding all the time and being in pain and constantly being on opioids for things. So I think for me, this is the best option. I did have a lot of relief 2 years ago when I had my surgery. I didn't get to see the surgeon today. You know, they've been very busy getting back on track with things after COVID shut them down for a while. So I am going to see them on Friday, and I'll be able to ask my questions then. They're also going to be, sorry, this is all over the place, I'm just trying to remember what was discussed and what happened. But they are going to do dye through my fallopian tubes, so just to make sure that the tubes are flushed and clear. So that's good, because it's always something that's good to be aware of. I am just trying to be open-minded about this going in, and remind myself, like, you've done this 2 times before, you'll be fine, and not freak out. That's the plan, and I will let you know how things go. And tomorrow I start on all of my prep and things, but I'm going to try to post this video pre-surgery, because I imagine it'd be better to have another, like a 3rd video that has to do with like the actual day of the surgery and that kind of time just after. Thanks for watching, and hopefully this helped you if you are concerned about surgery, if you don't know what to expect from your pre-op. Feel free to reach out at any time and ask me questions. Always happy to help, and I know that everybody's path is different, everybody's journey is different, and there may be things that they do for your pre-op that they didn't do for mine, or things that they did for mine that they don't do for yours. I will see you at surgery. Bye!